the emergency committee. We have Dr. Mike Ryan, and we have Dr. Maria van Kerkhove from Department of Diseases and Zoonosis Unit. Mike Ryan is the head of emergencies at WHO. You know, today was the first meeting of the emergency committee on the international health regulations on novel coronavirus, and I will give the floor immediately to Dr. Teters.
Thank you, Tariq, and good evening to everyone in the room and everyone online. We're really sorry that we're late, but thank you all for your patience. As you know, this is an evolving and complex situation, and I would like to thank Dr. Usa for his leadership of the emergency committee and all members of the committee, the advisors, and those who made presentations earlier today during the deliberation. I was very impressed by the detail and depth of China's presentation. I also appreciate the cooperation of China's Minister of Health, who I have spoken with directly during the last few days and weeks. His leadership and the intervention of President Xi and Premier Li have been invaluable, and I know you're following the actions they are taking. All the measures they have taken to respond to the outbreak. Today, there was an excellent discussion during committee meeting, but it was also clear that to proceed, we need more information. For that reason, I have decided to ask the emergency committee to meet again tomorrow to continue their discussion. And the chair, Dr. San, has agreed with that request. The decision about whether or not to declare a public health emergency of international concern is one I take extremely seriously, and one I'm only prepared to make with appropriate consideration of all the evidence. Our team is on the ground in China as we speak, working with local experts and officials to investigate the outbreak and get more information. We will have much more to say tomorrow, and thank you very much, and we'll be glad to answer any questions you have. But before that, I will give a chance to the chair, Dr. Usa, to say a few words, and after that, Mike to have to say on the actions we have recommended. Thank you.
Thank you very much, Dr. Tedros, and thank you for you all to be present this evening. It's true that the committee met during several hours today. We heard very interesting reports from the Republic of China about the situation in China. We also heard reports about the situation in Japan, in Thailand, and in Korea. Following this, we had also the analysis of the situation made by WHO Secretariat, and then we entered into a discussion about important advice to provide to the DG of WHO. That is the situation corresponding to a public health emergency of international concern, and what advices should be given to the DG. The views of the members of the committee, considering the information provided, was split about the opportunity to advise the creation, the decision of a fake. But we formulated a series of recommendations concerning the improvement of containment and mitigation measures, which are already important in China, and also about the measure that should be taken by member states. One of these measures is the improvement of sharing of information and cooperation between member states in such a situation. One of our advices was to suggest to the DG that the emergency committee should be reconvened very early if necessary. And in fact, the situation is evolving rapidly, as said Dr. Tedros, and for this reason we of course agree completely with his decision to reconvene the committee tomorrow, considering the evolution of the situation and the measures taken noticeably in China. Thank you.
Good evening, everyone, and let me again thank our member states for their excellent presentations today at the Emergency Committee, and also for their actions already taken in the face of this evolving epidemic. Just to briefly summarise to you that WHO has been on full activation of our incident management system since the last day of 2019 across the 3 levels of our organisation. We've been coordinating a series of global expert networks and partnerships that have dealt with laboratory diagnostic, assay development, infection prevention and control, clinical management, standardised data collection, mathematical modelling, research and development, and many other pillars of the response. We've been providing technical support to member states, both member states affected and unaffected states. We've been sharing critical updates with member states through our EIS platform with member states with disease outbreak news and through the WHO website. We have released a comprehensive technical package of interim guidance for 2019 nCoV. These materials are online, reviewed daily and updated regularly. We have updated travel advice for international travel and health in relation to the outbreak. In addition, we have been working very, very closely with global partners and the Global Coordination Mechanism for Research and Development for Epidemic Diseases as part of the Research and Development Blueprint, working with institutions such as CEPI and others on advancing medical interventions, diagnostics, therapeutics and vaccines. And at the moment, the landscapes analysis for those have been completed. We're working on sample and virus sharing. We're working on developing and disseminating clinical trial protocols and many other issues related to the carrying out of structured evidence-based research in the field as needed. The priorities right now, notwithstanding the deliberations of the committee, member states affected have implemented a number of control measures. These have focused, and WHO agrees, the primary issue is to limit human-to-human transmission, to reduce secondary infections, especially amongst close contact and particularly in healthcare environments. We need to prevent transmission through amplification events and super-spreading events, and obviously prevent further international spread. Reducing zoonotic transmission, or transmission from animals to humans, is important, and identifying the animal source or sources and limiting exposure to those sources is exceptionally important. We need all member states to focus on early identification and isolation of suspect cases and probable and confirmed cases, and we are working closely to equip countries to be able to detect and isolate and provide optimised standards of care. There are many unknowns to address in this event, including clinical severity and the true extent and nature of disease transmission. Communicating critical risk and event information to all communities is the responsibility of everybody, our member states, the media and WHO, and we at this time must particularly counter misinformation that may affect people's behaviour. And lastly, minimising social and economic impact is important at this time. So the organisation is fully activated at all levels with our partners in response to this event, and we await the further deliberations tomorrow of the committee as I said, we await those deliberations.
Thank you very much. Before we go to questions, first I have to apologize to Dr. Sylvie Briand, who is sitting next to Dr. Mike Ryan. Dr. Briand is our Director of Global Infectious Hazard and Preparedness, and she, together with Maria, may answer some of your questions. So we will start with the questions from the room. For those online, I will just repeat that if you have a question, please type 0 on your keypad and you will be put in line. We will take questions if our speakers agree one by one, and I will ask you to introduce yourself first and the outlet you are working with. So we will start with, I think, colleague from China.
I'm a journalist from CCTV. My question is to Your Excellency, Mr. Director General, Dr. Tedros, about WHO's evaluation of the measurements by the Chinese government in response to the epidemic. After the outbreak of 2019 novel coronavirus epidemic, how do you comment on the liaison and reporting between the Chinese government and relevant departments with WHO? With your expert group already in China, what evaluation does WHO have on Chinese medical institutions regarding outbreak control and patients' treatments? Thank you.
Yeah, thank you. Of course, this is a novel coronavirus, and it's a new discovery. So identifying the pathogen was done swiftly, and it shows the capacity that China has now. And the sequencing was done quickly, but more importantly, it was shared immediately. And that's why Korea, Japan, Thailand were able to diagnose the new coronavirus quickly. In addition to that, actions taken immediately, especially on the market, the Wuhan market, seafood market, and followed by other actions was very commendable. And the involvement of the leadership, starting from the president himself, who gave really clear guidance, the premier and the minister, was also very impressive and different actually from previously, from previous actions. You see the capacity and you see the political commitment. And that's continuing, and we appreciate that. But at the same time, although there is good capacity in China, they have also invited our experts. So our experts are now on the ground as we speak with Chinese experts assessing the situation, and that's why we're saying we will have more information. So our experts are and we will reconvene tomorrow. So that's what we see from WHO side, and we really encourage China to continue that way, because not only that will help China to clean the outbreak as soon as possible, but also to help in preventing it from spreading internationally.
Thank you very much. Please introduce yourself, Marco.
My name is Marco Clementi of Rai Italian TV. This is my question. Which is the level beyond which a local emergency becomes an international emergency according to WHO? That's the question.
No. Would you like to take over?
Well, I'll point you to the criteria in the IHR, and the international health regulations is a very specific formulation related to the international aspects of the risk. But there are three essential criteria about the nature of being unusual or unexpected, whether the disease has demonstrated transmission beyond borders, and in that it's not just necessarily the movement of a case to somewhere else. It may involve a determination of whether local transmission has occurred when that case arrives, and that's a nuanced and very important distinction to make. And also whether there has been interference or likely interference with travel and trade. So the IHR as an instrument is specifically designed to ensure that the appropriate public health actions are taken to contain the disease without unnecessary interference with travel and trade. There's a balance here to be struck, and that balance is something that the Emergency Committee tried to address and in their advice to the Director General. But that does not mean that public health action starts with the declaration of a fake. Public health action is already underway. Comprehensive international public health action in support of the affected states is already underway. what deliberation on a fake can allow is the issuance of temporary recommendations that are more binding in terms of international law on those member states. So one would ask the question, are member states implementing all those measures at the moment that we would consider necessary to contain this disease? And then beyond that, are there further temporary recommendations that will be needed? So in that sense, it should be a reinforcement of existing action, and that's why I took the time to explain the actions that are being taken. And in that sense, we need to separate the fake is a very particular concept in this regard.
Thank you very much. Stephanie, please.
There we go. Sorry. Reuters, Stephanie Nebehe. Could you tell us whether the panel, I don't know, would be appropriate for the chairman or Mike, tell us about the discussion of evidence that you were seeing about human-to-human transmission, and what evidence you might have been presented with about any mutation in the virus which, possibly has made it more transmissible, or any super spreading events that you may have seen. Can you give us an idea of what your understanding is at the moment?
I think we are in agreement with Chinese authorities, who have been very clear and transparent that there is evidence of human-to-human transmission, and the evidence points to human-to-human transmission in the context of close contact with a suspect case or within a healthcare environment. So the virus clearly, and this is not unusual, previous SARS epidemics and MERS epidemics have demonstrated human-to-human transmission. The current Ebola epidemic in Congo has gone through multiple generations of human-to-human transmission. It is not the existence of human-to-human transmission that purely determines the impact of the event. What matters is the route of that transmission, and whether we've identified those routes adequately and then give the proper advice to break the chains of transmission, and whether we can track those chains of transmission in an appropriate way. And we're back to the simple actions of public health: early identification of cases, identification of high-risk contacts, following those contacts and ensuring that if they develop illness that they're isolated quickly. So those are the principles. So we may go through generations of human-to-human transmission. If the route of transmission is still due to close personal contact and droplet infection, then the device or the disease is essentially containable. The issues that arise are the unknowns as to whether or not there are other routes of transmission occurring, and at this time it is not possible to determine that absolutely. It would appear that the main routes of transmission are along the expected routes of transmission for coronaviruses, and that is part of the extension of the deliberation of the committee, is to further consider these matters.
Thank you very much. If other speakers, does anyone want to add something to this? If not, we will give a chance to some of the journalists who are listening us online and who dialed in. We will start with Helen Branswell, if Helen can hear us. Helen, do you hear us well?
Yes, thanks very much for taking my question. I was hoping that perhaps Mike could expand a little bit further on the transmission issue. Have you clear indication that this is sort of stuttering transmission from among people, or are you seeing any sort of third, fourth generation cases among people? And I would also be interested in WHO's reaction to the news that Wuhan is effectively being quarantined. This is a very severe action, and I would like your thoughts, please.
Thank you very much, Helen. We didn't hear you very well, but I understand there was a question about a transmission and possible generations of transmission. The second part of your question, please.
The second part was I would like WHO's comment on the decision by authorities in China to effectively seal off Wuhan. It's a very a very severe measure, and I'm wondering what WHO thinks about that.
Thank you, Helen. We understand first question is about transmission, and second question is about measures put in place by Wuhan city. Who would like to take?
I can start and hand over to Sylvie or Maria. My understanding is that we have not at this point confirmed third, fourth generation transmission, but our colleagues can speak to that. And in reference to a previous question, Stephanie's previous question on the genetic diversity, the virus is showing stability and not showing a divergence or any unusual activity. All viruses change. Every time someone is infected, it's tiny differences in the virus, but we're not seeing huge changes in the viral genomic sequence in that regard. So maybe I could pass to Maria or Sylvie to just maybe address the issue of generational transmission.
So thanks for that question. So we had some, thank you. Thank you for that question with regards to human-to-human transmission. What we're very thankful to the colleagues to sharing information about the situations in their country. What our colleagues have shared with us is, as Mike has described, some human-to-human transmission amongst close contacts. And what investigations are underway to fully determine the extent of this. So at the present time, we don't know the full extent of human-to-human transmission, but what we've seen are human-to-human transmission events amongst close contacts in families and in healthcare settings. And as Mike said previously, this is not unexpected for a respiratory pathogen. We have not been presented any evidence or have seen any evidence of ongoing transmission where we've had third or fourth or fifth generation. But as we said, our colleagues are working very hard to better understand the extent of infection and where this infection is occurring.
Thank you, Laurie. On Wuhan, the measures that have been taken, we're following the situation, and we're in contact with Chinese authorities 24/7, and almost daily contacts directly with the minister himself. And what they're doing is a very, very strong measure and with full commitment. So based on the situation, taking the action that they think is appropriate is very important. We stress to them that by having a strong action, not only they will control the outbreak in their country, but they will also minimize the chances of this outbreak spreading internationally. So they recognize that. And they're doing both. That's for their own country, but at the same time, China should play a bigger role in global health, so they're taking more and significant measures to limit or minimize the international spread. So as long as it's tailored to the problem and with the commitment that we see, I think we commend their actions. But since we have a team on the ground, we will get more information on the situation and the actions being taken. I mean, an assessment of that. On the mutation, I agree with what Mike said. There is stability. We don't see any significant variation. But at the same time, we also believe that we have to be cautious and continue our assessments critically, because significant mutation can happen anytime. So we should keep that within our attention. Thank you.
Thank you very much. We will stay with journalists online. We will go to John Cohen from Science. John, can you hear us?
I can. Thank you. Can you hear me?
We can hear you, but please speak loud and go ahead.
Yes, I will. Thanks for taking my call. I just wanted to clarify what it is that the committee is deliberating. It seems like the three things that Mike Ryan ticked off have been met in terms of declaring a fake. So what is it specifically that gives the committee pause to determine a fake? What needs to occur Is it third-generation transmission? What is it exactly? All those things you mentioned, it seems, have been met.
Thank you, John, for that question.
Thank you for this question. Well, it's precisely the questions which were raised during the meeting of the emergency committee. It was the question of the assessment of severity and transmissibility. Of course, we had information provided by the Chinese authorities, but this information, of course, they are limited by the recent outbreak which has occurred, and the committee felt that it was a little too unprecise to very clearly state that it was time to declare, to suggest to the DG to declare a fake. This is why the opinion of the committee was split, and this is why we suggested that according to the evolution of the situation, we of course would be extremely ready to reconvene as soon as necessary in order to discuss about additional information, and clearly the information provided about Wuhan is one information.
Thank you very much. We will go back here to the room. There is a gentleman who really wants to ask a question here. Please introduce yourself.
Zhang Xin from Caixin Media. I have two questions. First, do you have any rough ideas about the victim of this virus, the people who died? Do they share any characteristics in terms of gender, age, or pre-existing health problems? And second, has the animal vector been identified, or which animal did the disease come from? Do you have any idea on that? Thank you.
Thank you very much for these questions. So it's about source and group of among populations. Maria.
Yes. So. Okay. Yes. So there have been some deaths associated with this outbreak, and from the information so far, there are some characteristics of those individuals. Many of them have had underlying conditions, underlying medical conditions, and have been of older age. Based on our past experience with other respiratory pathogens, advanced age and underlying conditions are known risk factors for developing severe disease and death. With regards to the animal source, there are many investigations that are currently underway in China, in Wuhan, and in the live animal markets, for example. We understand that they are investigating and taking samples from animals that were in that market, and they're also doing some environmental samples of those markets to determine if the virus is in those markets.
Possibly just supplement. Dr. Feng from the National Health Commission today presented a very deep presentation and gave a lot of very useful information. So Dr. Feng from the National Health Commission. From the data presented from China, the age distribution of the cases is, as Maria said, very much skewed to older age groups, with 72% of cases being over 40 years of age. The male to female ratio as males represent 64% of those cases. And interesting that they report also that 40% of cases had underlying diseases like diabetes, high blood pressure, cardiovascular disease. So we have to be very careful on looking at age distributions, because if the disease more severely affects older people because of underlying conditions, that doesn't mean that there aren't infections in other age groups. It just means that the visible infections of very sick people may be in those older age groups. So that's, I think, what Dr. Hussain was pointing to. It's the data we have, and we thank China for that data and for the excellent presentations today, but there are still unknowns, and we don't have the full extent of that data to do that. But from what we know now, 2/3 males, mainly people over 40 years of age, with this more severe spectrum of disease. And the cases, as Maria said, who died, many of them had significant underlying conditions, which is again a feature that we've seen in previous outbreaks of coronaviruses, if I'm not mistaken, Maria.
Thank you very much. We will go back online with James Gallagher from BBC. James, can you hear us?
Hello. I wanted to ask a very similar question to the one that Helen did, and that was about the public transport shutdown in Wuhan. And I suppose, first of all, wanted to know whether that was made in consultation with the WHO on the recommendation of the WHO, or is this something that was initiated by the Chinese authorities themselves? And also, what would you say to the people in Wuhan who in some respects are in quarantine in the face of this novel coronavirus that you've not decided whether or not is a global emergency? What do you say to the people who are really living this tonight?
Thank you very much. Someone would like to answer this question?
On the public transport and other mass gatherings, as you know, should be avoided. So they are taking measures based on that. And although our recommendations were going to go based on the discussion today later on, but these are from our previous discussions, and they know the measures they should take in order to prevent transmission, especially mass gathering is one of the risks. We don't think on public transport, we cannot say they have done something unusual. On the population, I think the measures which are taken, as I said, they were just announced today, so we will need some time to understand the specific measures that are being taken. Since we are working with them, if there are any recommendations that we should give them, we can give them.
Thank you very much. Hope this answers your question. We will go to Denise Grady from New York Times. Denise, can you hear us?
Yes, thank you. Can you hear me?
Yes, please go ahead.
Okay, thank you. Dr. Ryan, could you please clarify the numbers, the figures that you just gave? It wasn't clear to me if with the percentages you were talking about the overall picture of people who are sick or the people who have the severe cases. So if you could go through that again and make it very clear what those numbers are again. Thank you.
Yeah, the data we presented was referring to what were reported today, which was 291 cases, which it included those clinical cases requiring admission to hospital. So probably, as I said, at the more severe end of the spectrum. The figures that I quote of 64% male and 72% over 40 refer to that group of 291 individuals. I hope that clarifies.
Okay, thank you very much, Denise. Please.
Actually have a vote on this, and was it a tie vote or something? Is that what you mean when you said there was a split?
You are questioning the divergent views within the committee?
Yes.
50-50, even.
And thank you very much. So we go back here to the room. Gabriela, please.
Yes, thank you very much. Gabriela Sotomayor, Proceso, Mexico. I have one practical question. What is going to be the name of this virus? Do you have it already? I mean, what is going to be the name? And is the virus spreading exponentially? What is your observation on this? Thank you.
Dr. Brian, please.
Currently, we use the name 2019 nCoV for novel coronavirus. but we will convene a committee to decide on the official name. As you know, the tradition for viruses is to name them after the place they have emerged, but being discovered. But yet we have, it's not known yet because investigations are underway. And so we are for the time being using this nickname, I would say, and the committee will further discuss what is the appropriate name for this new virus.
Yes, maybe do you want to on
sure.
question of...
this relates to earlier questions about what we know about the human-to-human spreading, and it is still very early days, to characterize the full extent of this human-to-human transmission. What we're hoping for from our Chinese colleagues, and also from any countries that have an exported case or a case imported into their country, is to look for onward transmission. What level of secondary transmission amongst close contacts exists? We haven't seen any secondary transmission from any of those exported cases, and that is quite important. Within China, we've asked our colleagues in China to further explain to us what they're doing to better understand the extent of infection in Wuhan, but also in other parts of China. And then, importantly, amongst those cases that they've identified, how many of those are related to human-to-human transmission, and then in what context did that human-to-human transmission take place? Was it in a household? Was it in a healthcare facility? Was it in the community? So those are critical pieces of information that we need to know to be able to characterize the full extent of transmission.
And maybe I could supplement here, because there's a difference between a daily reporting of cases and when those cases had their onset. And many of the cases reported over the last 2 days could be cases that have been picked up retrospectively based on enhanced surveillance. And their dates of onset may be over many, many days, many weeks. We don't know. That is why we did receive some really helpful disaggregated data from China a number of days ago around the original cluster around the Wuhan thing. Around the Wuhan cluster, around the seafood market. It will be extremely helpful at this point that China, and I believe they have every intention to do so, is to share that disaggregated data, because it's really important that we're able to do that secondary analysis, construct those epidemic curves, and estimate the doubling times and the rates of movement of the virus, both in terms of temporal rate and the geographic rate. So we look forward to receiving that data from China as soon as possible.
Thank you. First, I have Mohideen and I have Body first. Go ahead, and then Mohideen.
I have to comply because we need more opportunity to Chinese media put more questions, whatever here or online in Chinese issues. So, j'ai une question pour Monsieur Aussin. Plutôt que si je comprends bien, M. Tedros qui a dit, il paraît que c'est vous, le comité, donne le conseil que Wuhan faut être isolé comme... Est-ce que j'ai bien compris? C'est-à-dire, vous proposez que la ville, ça pourrait être plus foncé ou plus strict. En plus, I have another question to Mr. Tedros. Could you give us our exact time for tomorrow? What time you will give us our results or answer? Whatever, morning or afternoon, but we need at least an exact time or around. Thank you.
Okay, just to say that first question was about whether the committee is giving directions to Wuhan authorities on their actions or not, and that was directed to Professor Usam.
Thank you. I will start maybe from the second one, because you want to know when to come. So we will start at noon, like today, at 12. On giving advices, we give advices to China, the national government, and also, of course, it will not be limited to that. And most of the guidelines are given to the international community too, so to countries, neighboring countries, and beyond. Thank you.
Thank you very much. Mohideen, please.
Sorry, Mohideen from Eurovision News. What advice would you give people who are planning to travel to China? Should they
cancel or postpone plans, and also what precautions for those who deem travel necessary should people be taking if they are visiting China?
We will come back with tailored recommendations tomorrow. That's why we're reconvening tomorrow.
Okay. Yes. Yes, because the question on the role of the committee was directed to the chair.
The response is no. The committee did not provide an advice concerning the measures to be taken in Wuhan, but it's clear that the information about the measures taken by the Wuhan authorities very recently, today, are important information and will certainly be useful to the reflection of the members of the committee tomorrow. Thank you.
Okay, thank you very much. I'm just checking if we have more questions online. I'm just saying, repeating again that those who are online and want to ask a question can type 01. I would like to see if we have a Euronews online. Hi, Gerard. Please go ahead.
Yeah, so we were wondering, how can we differentiate between virus or the flu? And in Europe, without no borders, how can governments apply these procedures to restrain the epidemic?
Gerard, did you say that how we can distinguish virus from the flu?
Yeah. Yeah.
Yes, so that's a good question. Thank you for that. So many of these respiratory pathogens that are circulating are, it's very difficult to distinguish between different viruses. What we understand from the 2019 novel coronavirus is that it can cause a range of disease in individuals who are infected, from mild disease all the way to severe disease and death. That's quite a range. Investigations are still ongoing to better articulate what proportion of individuals will have mild disease or severe disease and what risk factors they may have to result in more significant disease. In the beginning of an infection, you start out perhaps with some mild respiratory diseases. What we refer to are the diagnostics that have been rapidly developed thanks to the rapid sharing of sequences by Chinese authorities. So there are labs all over the world now that are able to detect this virus in patients. And so our recommendation is to ensure that individuals can be identified quickly and isolated quickly, tested quickly, cared for, and managed so that they can prevent any further transmission.
Thank you very much. We will maybe take one or two last questions before we conclude for tonight. Maybe we start first with Betsy McKay from Wall Street Journal, and then we will give the floor to our John here. Betsy, can you hear us?
Yes, can you hear me?
Yes, please.
Okay, great. Thank you very much. I just wanted to ask a little bit more about the contact investigations going on in China, how much information you have on them, and given the rapidly expanding number of cases, do you feel that China has the capacity to do these contact investigations at this time and stop the spread, or does it need help from outside?
So I'll start with that question, and maybe others would like to add to that. So what we understand in terms of the activities for looking for cases is that Chinese authorities are conducting what we know as active surveillance. As you've heard, the initial cases were picked up through their pneumonia surveillance system, which was established after SARS. Once they identified that cluster, they initiated this active case finding and retrospective case finding of individuals who had pneumonia. Of the people that they identify with infection, they identify their contacts, and then they follow those contacts for a number of days. So they're doing some active contact tracing amongst the identified patients, but they're also looking at healthcare workers, family contacts, and healthcare workers. And so those investigations are ongoing. We've requested more information to get better details on this. But yes, it's active surveillance and then contact tracing amongst those identified.
Thank you very much, Dr. Van Kerkhove. John, please, if you can just come to the mic.
Yes, good evening, John Zarakostas, France 24 and The Lancet. I was wondering, sir, in your deliberations this evening, if you analyze the prospects of the trend in case fatality. Do you anticipate it shooting up? It's quite low at the moment at around 3.8%, but in other cases of similar coronaviruses, it's been much higher. What's the information coming from the field? And secondly, with reference to antivirals, what are the prospects of coming up with one that's effective? Thank you.
Yes, the question about the fatality rate is clearly one of the question mark which was raised during the meeting of the committee. If we refer to the previous coronavirus epidemics in 2003 and more recently with the MERS coronavirus, the fatality rate was much higher than it appears to be today. But this is one of the aspects which needs to, for which we would like to have more information, because it's, of course, a very important point to decide whether it is a major public health threat or not. That's the response.
Thank you very much. And maybe we can really take the last question for tonight from...
Antivirals.
Antiviral, sorry.
There have been a number of compounds that have been used in the fight against coronavirus, but it's very important to recognize that there is no recognized effective therapeutic against coronaviruses. There are protease inhibitors and interferons that may help as adjuncts to treatment, but they have their own issues with toxicity. So the primary objective in an outbreak related to a coronavirus is to give adequate supportive care to patients, particularly in terms of respiratory support, multi-organ support, because the disease can cause a multi-organ failure, and many patients can be saved in that regard. However, there are potential clinical trials that could be done with agents, and that's what we're really focused on right now, is identifying other therapeutic agents and other opportunities to test new drugs. And again, we've been working very closely with authorities in the 4 countries, and again, very much welcome, particularly in this case, the participation of Chinese experts on all of the expert networks that are helping us to move towards one of the opportunities that sometimes can get lost in an epidemic is not collecting the structured data to understand the clinical disease, and then using drugs even on a compassionate basis, but collecting the data in a structured way under what we call a Muri protocol, which is a protocol that allows the compassionate use of drugs, but also collects very important data to allow us to advance knowledge. And again, we thank all the countries for working with us to this end. I don't know, Sylvie, you want to add anything there from that?
No, I think it's really part of the research effort and research collaboration that WHO is coordinating currently to make sure that discovery also on therapeutics and vaccine is accelerated as much as we can.
And just to remind everybody, the Research and Development Blueprint for Epidemics has a broad global partnership called the Global Coordination Mechanism, where all of the major research institutions in the world are involved in that collaboration. And again, this is the type of collaboration we need: the sharing of sequences, the sharing of viruses with the provision of guarantees around the adequate benefits that go with the sharing of clinical knowledge. This is global solidarity in action, and we need to see that continue in the coming days.
And if I might add to say that, the global community has learned a lot from SARS and a lot from MERS, and we're building upon that knowledge. So the advancements that have been made for diagnostics and therapeutics and vaccine, as Mike has said, through global collaboration and with the Research and Development Blueprint, the advancements that have been made for MERS over the last 7 years could be applicable here. And so that we're trying to build upon that knowledge base to see if that work can help in the current situation.
Thank you very much. Maybe I will say the final thank you, I think.
Okay, well, I promised this lady one last
question.
You
did?
Okay.
I didn't know.
Short. Natalie Meyer from Kyoto News.
As you mentioned SARS and previous outbreaks before, I was wondering if you could comment on the Chinese transparency and if you could draw a comparison to the outbreak now.
I think on the Chinese transparency, probably I have said a lot earlier, so it will only be a repetition. But the cooperation and transparency is very, very commendable, and we really appreciate, and we want that to continue. And today, the committee members have witnessed that during the presentation from China, when they were presenting the details of what's happening. So I would like to encourage them to continue that way. Transparency is very important. That really, really helps. And if we're going to keep the world safe, transparency is number one. And that's what we are seeing happening, and we encourage them to continue in that direction. You have also heard, I think, from the Chinese leadership exactly the same thing. We have to be transparent and do everything we can to protect ourselves and also to protect the international community or the world. So with that, thank you so much again for joining us, and my apologies for keeping you waiting. And tomorrow, as we said, we will reconvene at 12, and any information that we will have, we will keep in touch with you. Thank you.
Thank you very much, DG. Thanks, everyone. And yes, tomorrow we will inform you about ways we will communicate the outcome of the emergency committee. Thanks again, and thanks for patience.
Tämmönen tunnin pätkä sitten. Mitähän tähän nyt osaa sitten sanoa? Wuhanista tosiaan suoria lentoja on pitkin maailmaa ja ilmeisesti ainakin Amerikassa on. No? Pistetään tuo piippaus kiinni. Muuten rupeaa käymään korville. Mutta joo. Kiinassa Wuhanissa tosiaan on se kaupunki kiinni. Homma hieno. No mä en vaan lähtis käymään tuolla mikä nää nyt on, Rovaniemellä tai missä nämä kiinalaismatkailijat on. Se on ilmeisesti 14 päivää se itämisaika tuolla taudilla. Sen oireet ei hirveästi ero mistään tavallisesta kausiflunssasta, minkä takia se on vähän huono. Tunnistettavaa. Joo, aika lailla kannattaa kiinalaiset boikottia, että täällä kun rauhallisesti annetaan olla omalla porukalla ja pyörii niin kuin normaalisti omaa arkeaan, niin todennäköisyys, että se leviää. No siellä on just, että näiden matkailijoiden mukana, mitä Wuhanista on lähtenyt, niin tää voi lähteä leviämään. Mutta pistetään agenda freetä sitten Sanohan nyt varjolähetystä. Jossain vaiheessa, jos se leviää paljon, niin silloin sitä todennäköisesti jossain vaiheessa viranomaisetkin se huomaa. Sitten siitä tulee varoitus.
And we already mentioned earlier the WHO delayed, the World Health Organization delayed for a day its decision on whether to declare this virus a public international health emergency. Public health emergency of international concern. They're going to do another announcement tomorrow. See, Helen Branswell, she says, someone just suggested this outbreak has a case fatality rate of 3%, and that is low. I beg to differ. We do not know the case fatality rate yet. And she also says 3 people out of 100 dying is not a small matter, lower than SARS, yes, but still very serious. But she says we do not know the case fatality rate yet. Hang on one sec here. Rory Garrett says, panic unfolding in Wuhan hospitals over coronavirus. On January 22nd, many hospitals in Wuhan faced an extremely high load. Fever patients lined up to see the results of pneumonia testing. Hospital corridors are crowded with waiting citizens. You know, with 11 million people, there's going to be plenty of people who just have a cold or have the flu. And, I mean, all those people might think they have this virus. So you might have a huge rush of people going to hospitals to get tested for the virus. This virus gives people pneumonia, which is a disease of the lungs, and the symptoms of the virus are a fever and also coughing and difficulty breathing. Those are the chief symptoms. Specifically, shortness of breath with the difficulty breathing. Hold on, I covered up the video. Anyways.
大家都不要说话了，听我的，安静。首先，在这把所有看结果的人全部在外面排队起来。对，看结果的人跟着这位小伙子在门口去排好队去。啊！我们这边排好队，先出去排好队，不要紧张。
我不知道这是叫号啊还是排队，叫别个病人在这里站几个小时，这不是互相交叉感染，你就叫号就叫号了。
Not good. Let me check something here. You are watching Agenda Free TV. Just a reminder, if you Agenda Free TV is a viewer-supported channel. I do this channel full-time, day and night, 7 days a week, to bring you live agenda-free news coverage from around the world. But your donations are actually what keeps this channel on the air and allows me to do it. So if you do like the coverage and you want to support with a donation, you can go to agendafree.tv, agendafree.tv, or you can go to the bottom of the YouTube chat and click on the dollar sign there. Or if you're watching on Facebook, you can donate using Facebook stars, where you buy some stars, you give them to a channel, and the channel basically gets what you paid for the stars, minus a small cut for Facebook. You can do that by clicking on the star button in the Facebook chat. And in Periscope, you can donate using Super Hearts by clicking on the star button next to the chat room. And thanks for the Super Hearts default user Sharagoins, Katie Murray, Dalton, Ghosty Girl, JoJo's Dackett, Dree, Magic Moon, and Misha. I appreciate that. Send me your comments. We're going to be taking your comments on the air at Lookner on Twitter. And as I mentioned, we've seen a couple videos purportedly from Wuhan of traffic of roads being shut down. That's one from CNW. But I don't have a great picture of how things are right this second. And I'd be careful if you see videos on the internet. They might be legit, they might not be. See, I have no idea if this is legit. This is account Badiukao that says videos showing hospitals in Wuhan are building tents as space extended for Wuhan coronavirus. I would not be surprised if this is happening. I mean, if you have to isolate people, I would have to imagine that you'd have to create extra space for all the people you need to isolate. But I don't know if that video is legit, but it very well might be. I mean, this would not be a surprising thing if it's actually happening. Wicked Fair says the line at the hospital in Wuhan is a nightmare. If you didn't get the virus yet, you do now. Well, hope not. Hey, thank you, Wicked Fair, for your support. I appreciate that, Wicked Fair. Thank you. But yeah, you got to be careful with the like videos you see coming out, supposedly coming out of there. Joe says, "Are there any updates on the Washington case?" I have not heard any updates about the person in Washington State who has it. I have not heard anything. I can check a local outlet. They have no updates on this local. This is the Snohomish County. It's Everett, Washington, where the person is, HeraldNet. I haven't heard any updates about the person in Washington who has it, about their condition. Maybe we'll hear something later today. Peter Day says, Lori Garrett is a Pulitzer-winning science reporter. I went to the same high school as her. She knows her stuff. Thank you, Peter Day. Linda Belk says that one of our viewers on Periscope says they're at the San Francisco airport and is seeing masks, heat wands taking temperature, and some panic from the Asian flights coming in. Now, they are at 5 U.S. airports. San Francisco, JFK, New York, LAX, Atlanta, and I think one of the Chicago ones, definitely at least one of them in Chicago. They're directing all passengers from Wuhan to those airports and checking them for visible symptoms as they come into the country. Now, certainly somebody might not have visible symptoms now, and then they get in the country, and then they have the symptoms later. But look, the Wuhan airport is shutting down at 10 a.m. So they won't have to check planes for Wuhan starting later today, because there will be no planes. The Wuhan airport is shutting down at 10 a.m. Wuhan airport shutting down it's about 5 hours from now. About 5 hours from now, the Wuhan airport will be closed. All the train stations are shutting down. All public transportation is shutting down in Wuhan. They're basically quarantining the city of 11 million people. Hey, thank you so much to Ksenia Kiparina. I appreciate your support. Thank you, Ksenia Kiparina. Thank you. Oh, here's an update from Rami Inocencio, who I think is in Wuhan. Rami Inocencio, he is with CBS News. I'll show some of this. I don't know if I'll show all of it. So let's watch the first part of it and see what he says. And then you can go to his account and watch the rest of it. Let's see what he says here.
Hey there, guys. So I am at the Wuhan airport right now. CBS is taking off back for Beijing after being here for 3 days, ever since Monday. Now, what's notable here is that basically everyone is wearing a mask. When I landed on Monday, maybe about 25% of the people who I saw had masks on as we were getting our bags, as we were leaving the airport. But as you can see right behind me here, everyone on my right side is wearing a blue mask, usually blue mask, some black mask here. The N95 mask is the one that is supposed to be the best kind. Those are running out, or they're really expensive. So we're just seeing people just wearing any kinds of masks also. The surgical masks, the blue.
Now, by the way, so he says this was Wednesday night. So that video was shot before the lockdown was announced. But it's interesting. He's saying that even a few days ago, most people were not wearing masks at the airport, and he says now they all are. So you can watch the rest of that at his Twitter at Rami Inocencio. But I thought when I first saw this, I thought it might be from like 5 minutes ago or something. But it's from it looks like they left shortly before they announced the lockdown. Let's see here. Again, write to me for your comments, updates at Lookner on Twitter. Connie Willard Godin says, wonder if all world agencies working together on the rapid test, etc. Hope so. I don't know, that there'll be any test that they can give somebody like right on the spot. I mean, maybe there'll be some rapid test where they can take somebody's blood or something and put it in a machine. But the CDC says they're working on some tests, but it sounded like the test would be one that you would need to have like some equipment for or something. We'll have to see. Ava Kunzelman says, do they know who patient 0 is? Oh, no. I don't think they know who patient 0 is. I mean, because it's just like you wouldn't, how would you know? You know, when the first person who got this, they wouldn't think that it's a new virus. They wouldn't think it's a new virus. And so my guess is that they wouldn't have, they might know people who initially had it. I'd be shocked if they knew a first person who got it. Supposedly it came from animals first and then it, transferred to humans. Thank you also, Terrence Barry, for your kind words. Hang on a second here. Hey, thanks to our moderators. We have Amber Licious moderating right now in our YouTube chat, Becky Scarlett, Mark Helton. In our Periscope chat, MDMA, JKD, Linda Belk, Sharon Craig. Our Facebook moderators, people like Kimberly Peterson, Courtney Lane, Dan Lindquist, Essen Smith. And our Twitch moderators, people such as Keisha, Umarath, Idaho Star, Smoke, Daily Disclosure, Matthew Johnson, and others. Thank you to our moderators. So I can't imagine, what is it like right now? Think about this. What is it like in Wuhan? It is currently 5:03 a.m. in Wuhan. It's 5:03 a.m. there. So a lot of people, well, I don't know how many people are awake yet. Maybe people who were awake in the middle of the night around 3 a.m. when this announcement came out started calling people and waking them up. So maybe a lot of people are awake at this point because people have called them and woken them up. I don't know. But I'm sure in a city of 11 million people, there are plenty of people still asleep. So what are people doing? If you're in Wuhan and you get this call or you get this announcement, do you try to leave? I mean, if your apartment is there, you might think, or your house is there, you might think, well, if I leave, they're not going to let me back in. I bet people might be worried if they leave there. I don't know what crime is like there. I know in the U.S., if there's a fire and they tell you to evacuate, some people don't want to leave because they don't want their house to get broken into. But I mean, this is the case where if you leave the city, for all you know, who knows how long it'll take to get back in there. But on the other hand, you might think, I'm in a city with lots of people who have this thing. I want to get out. Also, the big holiday is coming up in the next couple of days. So if you planned on going to see your family, so difficult choices for people, I assume. And then also so like if you take public transportation to work, there'll be no public transportation. So how do you get to work? Do you just not go to work? How about businesses like a factory where, let's say there's a factory where half the workers take the bus to work. Well, now they can't get there because there's no bus. So what does the factory do? Just think of the disruption. Are people utterly panicked? I mean, what if they told you can't leave your city? And you had a few hours notice. It's just, maybe people are just super panicked. What are people thinking? I don't know what it's like there. I'm guessing maybe if you were in China and you knew where to look, you could find people like posting on social media about it, but I don't have that information. So maybe some people I follow might start, putting stuff out there from social media. Hey, thank you so much, American Rebel 27, for your support. And thank you, American Rebel, for thanking the mods. I appreciate that. Ugly Penguin says, flight from Wuhan is on its way to Rome currently. I will check the flight radar in a second. Thank you for the reminder, Ugly Penguins, and thanks for the support. I just wonder, what is it like in that city right now? Hey, thank you, Tammy Just, for the Super Heart. And I don't know that people knew this was, generally had an idea this might happen. I mean, it's very sudden, and it was announced at 3 in the morning. 3 in the morning. Randy says, I'm going to Thailand 1 week from today, ARG. Amber Baker says they probably got alerts on their phone. Maybe it woke them up. A good point. Maybe they sent out cell phone alerts and are broadcasting at all the TV stations. Now, remember also, our viewer Jacques talks about the economic effects. Think about the effects of this on China in general. Wuhan is a major transportation hub for China. There's lots of flights that go in and out of there in China. There's also lots of, it's a major train hub for China. Lots of trains pass through Wuhan. And now the stations are shut down. Now, I guess maybe the trains will be allowed to pass through without stopping there. But, if you're somebody who would take a train or a plane and transfer it Wuhan, I guess you're not going to be able to do that anymore. I mean, no planes are going to be taking off. And the train stations are going to be closed. It's just unreal. Let's check the flight radar situation. Here is Wuhan Airport. All the planes you see are going to or from Wuhan. That is a plane right there that took off. I don't know where where is this? Sihanoukville. That's in Cambodia. That plane is flying to Cambodia. So that took off about an hour ago. There are some planes about to... Now, look at this. What are these people going to do? There's people who are flying to Wuhan right now, right? Look at all these planes flying to Wuhan. So you get to Wuhan. I'm sure there are people on these planes who are flying to Wuhan who have just heard, wait a second, I'm flying to this place that when I get off the plane, I can't leave. Think about that. So you're on a plane to Wuhan, and you're like, I wonder if people are like trying to convince the plane to not land there because you're going there and you can't leave. You'll get there, and what do? The plane's not going to take right away. You're not going to get on another plane. I'd be shocked. I wouldn't be surprised if they stop the trains and people leaving early. But a bunch of planes, flying into Wuhan, people are going to be stuck there. That one's going to Rome. That's coming from Paris. So all these people from Paris who flew to Wuhan are going to be stuck there. They're supposed to land at 9 a.m. I don't think they're going to get out. Jeez. Now, maybe they'll make exceptions for some people. Honestly, I bet you could bribe somebody to get out, to be honest. I wonder if there'll be a lot of bribes to get out. Like wealthy people will give somebody some money and they'll let them slip by. Wuhan to New York. This plane from Wuhan is landing at JFK tonight at 9:29 p.m. See, Wuhan to New York. Lyle Wiley says, obviously this is much worse than the Chinese authorities are telling us. It must be really bad. Hey, let's check the departures and the arrivals. I don't know if they've announced cancellations yet. Yeah, you're going to start seeing like lots of canceled. See how these all say estimated and stuff? Eventually it's going to all say canceled. They're just not posted yet. Arrivals. They'll have to cancel these arrivals too. Yeah, you're going to see a lot of canceled coming up in the coming hours. So I'm just checking some other sources here to see if there's some updates. Again, I'm just checking some different sources and seeing if there are any updates on the situation in Wuhan. Just looking around here. Lori Garrett, who's a specialist, former Pulitzer Prize winner says, I confess I'm vexed by today's WHO decision saying that they're going to delay for a day their decision on whether to name this a international public health emergency. What new data are they waiting for to decide tomorrow whether it is not a public health emergency? It already meets the 3 criteria for public health emergency. I suspect debate inside the panel is robust. All leads lead to and from China. So she's saying she can't figure out why they wouldn't just decide today whether to declare this a public health emergency, international public health emergency. Ugly Penguin says, don't let the plane land in New York. Well, it's going to land, and they'll check the people from Wuhan for visual symptoms, and for all you know, some of them have the virus and don't have visual symptoms. Thank you, Ugly Penguins, for your support. Here's a BBC article on it. Wuhan to shut public transport. Well, they're also not going to let anybody out of the city. Those living in the city have been advised not to leave. The airport and train stations will be closed. All public transportation will be shut. Those living in Wuhan had already been told to avoid crowds and minimize public gatherings. British scientists, as I mentioned, now estimate 4,000 cases, not the, 560, which is the official number of total cases. Vasco da Gama says, if the plane is on its way to Rome, are the Italians ready to screen people like they're doing in JFK in San Francisco? I have to imagine that in the plane going to Rome, they're going to meet it when they get off and at least visually screen people for obvious symptoms. I would have to imagine that, Vasco da Gama. Thank you, Vasco da Gama, for your support, by the way. I can look it up, but I would have to imagine they're screening people. But the problem is, Vlasko's from Croatia. The problem is that the incubation period is up to 14 days. So there's a significant chance somebody could have the virus and just not be showing symptoms of it. Yeah, look, see? Rome airport screens for deadly Wuhan virus. Wanted in Rome. That's an airport. Rome's Fiumicino Airport is screening passengers arriving from Wuhan. It has free direct flights from Wuhan, as well as many non-direct flights. And it just shows you there's people who have it in lots of different places in China and also in countries not in China. Imagine shutting down London before Christmas. James Gallagher. Wuhan is starting to look like a city in quarantine. Officials had already warned residents not to leave the city and visitors not to come. Now the reported public transport ban, which includes flights, slams many of the routes in and out of the city shut. It is a significant attempt to stop the spread of this new virus, which we now know can spread from person to person. Limiting transport will cut the chance of the virus reaching other cities in China and other countries around the world. This all comes just as millions of people are traveling and have been traveling across China for the week-long holiday that is Lunar New Year. If you're struggling for context, imagine shutting down London in the week before Christmas. The big question left is the roads and whether any of Wuhan's 8.9 million inhabitants will be able to simply drive away. That's interesting. I'm sure there's lots of roads that you have to... I don't know how many roads there are in and out of Wuhan. I mean, there's Wuhan, there's highways, but there's probably, smaller streets too. And also, I mean, look at the size of this. There's Wuhan. Look at how big a place you're talking about. Let's do a measurement, okay? Measure distance. That right there, that's 70 miles. That's 70 miles. I have to look this up. Wuhan size. Area, urban area is 590 square miles. I want to actually post this. According to Google Maps, the city of Wuhan, where authorities are not going to let anyone leave, is 70 miles wide. Look, 70 miles. So it's going to take a lot of manpower to shut off 70 miles on each side. 70 miles. That's what it says. If that's the city they're talking about. According to Google Maps, the city of Wuhan, where authorities intend to not let anyone leave, is 70 miles wide. So I wonder if people want to get out, will they be able to find a way out, like on the road, or take a boat or something?
No siis tuo on noin 100 kilometriä halkasijaltaan tuo 70 mailia, eli 100 kertaa 104 kilometriä. Tässä nyt tekee 10 004 kilometriä. Eli aika perhana iso pläntti. Mutta mä lueskelin tällä THL:ltä, että kun mietitään, että 11.15 on tänään päivitetty tämä THL-ajankohtaista Wuhanin koronaviruksesta, niin silloin oli tieto, että 400 tartuntaa ja 9 kuollutta, niin melkein kaksinkertaistunut 17 kuolleeseen tämän illan aikana tiedot, eli 12 tunnissa. Joo, THL näyttää olevan aika selkeät, että laitetaan tietyt mikrobiologiset tutkimukset. Sille ei ole vielä olemassa semmoista omaa tutkimusta, mutta sitä mukaan kun semmoinen kehitetään, niin varmaan se otetaan käyttöön, että nyt tehdään näitä yleisiä virustutkimuksia, jotka on mahdollisimman kattavia, mutta se on tietysti aina kalliimpaa kuin spesifi. Sitten on tuon ECDC:n European Center of Disease Prevention and Control, eli terveysjärjestö tämäkin, niin, tai terveysvirasto. Täällä on samaa tietoa. Siltä voisi tietysti ruveta kääntämään, mutta suomeksi on ihan vastaavat tiedot, että ainut uusi tieto oli, että 448 laboratoriossa varmistettua koronavirustapausta. Eli nämä on tutkimuksella varmistettuja. Thaimaa, Japani, Etelä-Korea ja USA on varmistuneita tapauksia. Wuhanin, Kiinan lisäksi tietysti. Ja Ranska, Pietari, Brasilia ja jäiköhän joku muu, missä on epäilyksiä. Alkuvaiheen tapauksia yhdistää oleskelu Wuhanin torilla, missä myyään mereneläviä ja eläviä eläimiä. Ja tartunnan lähe ei ole tiedossa. Virus voi ainakin jossain määrin tarttua ihmistä toiseen, mutta leviämisen tehokkuutta ei tunneta tarkasti. Koronaviruksen joukko viruksia, joita ihmisillä ja eläimillä aiheuttaa tavallisesti lievä hengitystieinfektio. Vakavampia tautitapauksia aikaisemmin SARS- ja MERS-koronavirukset. Uusi koronavirus on SARS-koronaviruksen kaltainen. Voidaan ehkäistä hyvällä käsihygienialla. Suomessa ei vielä ole todettu ja sairastua Kiinassa ja Aasiassa on pieni. Wuhanin alueelle matkustamiseen voi liittyä riskitartuntaan. Tämä kuulostaa, että kansainvälisen liikkuvuuden matkailuun yksittäiset tapaukset on mahdollisia. Kuuluisat yksittäistapaukset. Sitäkään ei kerrota, että onko tämä vielä itämisvaiheessa leviämiskykyinen tämä virus. Maailman terveysjärjestö ei suosita erityisiä toimia matkailija eikä rajoituksia matkustamisen kansainvälisen kauppaan. Suomesta ei ole suuria lentoja Wuhaniin. Että näin. Pistetään takaisin agenda-telkkari.
Yua Song says, do you think the Chinese military will be involved in Wuhan? Well, if you're trying to blockade and prevent anyone from leaving a city of 11 million people that, according to Google Maps, is 70 miles wide, I would think you might need to use some of the military. I don't know, but, to prevent people from leaving. Also to keep order. I mean, who knows what kind of disorder could result in a city if people all think they can't leave? People could panic. Oh, Tim says this is the Wuhan airport website. Thank you. Tim sent me this. I was trying to find this the other day. I don't think I could find it. So this is arrivals. They haven't canceled these yet. They will. Where's departures? Departures. Yeah, these are all going to be canceled. But it just all says scheduled right now. That's Wuhan Airport. It should say, see, it says departures here. Is this the official site, though? Is this their official site, or is this like another site that this is not, all right, this is not the official website. It is not the official website. It says this is not the official website. They say that. So to be clear, that's not the official airport website. It says it at the bottom. I don't know where the official website is. That's the one that comes up, but that's not the official site. I couldn't find an official site. Hey, thank you so much, Bob Fillmore from Canada, for your support. I really appreciate that. Bob Fillmore, thank you. Platypus says maybe the flights that are currently landing can land, refuel, and take off again without letting anyone leave the plane. Well, my guess is that the flights that are about to land, and the flights that are about to land in over the next few hours at the airport, I'm guessing they might let the planes leave so the planes can be used elsewhere. But I'm guessing if you had a ticket to Wuhan, I don't know if the airline, I don't know how they'll handle it, because there's people flying into Wuhan right now who will be trapped there. So I don't know if airlines are going to give them the option to leave. I don't know how that'll work. It's just a giant mess. But there's people who got on airplanes to go to Wuhan, and while on the plane, this order came out saying the airport's closing at 10 a.m. and saying you can't leave the city. Hang on. Sorry, I need to clean up my desktop. I have too many things open right now on my desk. I need to clean up some of it. Oh, the head of the WHO just posted and said, the decision about whether or not to declare a public health emergency of international concern on new coronavirus is one I take extremely seriously and one I am only prepared to make with appropriate consideration of all the evidence. Director General of the World Health Organization. They're going to decide tomorrow. Crawford Killian says, he is somebody I'm following, retired college teacher, but he has some interesting posts about virus stuff. His opinion is that I believe they're talking about the quarantine. Enormously expensive decision, especially given Lunar New Year traffic and general tourism, could make Xi look foolish if the virus continues to spread outside Wuhan. Well, another way it can make him look foolish is if lots of people get it. Yeah, well, in the sense of they could have done this a week ago, and they didn't. I've seen speculation that maybe China didn't want to, start preventing people from traveling because this whole travel period, this Lunar New Year period, is like a big economic stimulus for the country. See this person, there's some people just discussing this on Twitter. A couple of whom I follow. One of the people who I don't follow, but this person says, they say Wuhan is a major, Philip Lee says, Wuhan is a major transit hub, a crossover point for 9 provinces with 30 million expected to pass through for Shenyang. This is huge. Oh, he also said, according to a release by the Chinese authorities, they've set up roadblocks in all access out of the city. They aim for zero leakage for those who have a fever and anyone accompanying them. He also says, if there's one place where draconian control of the people is likely to have an effect, it's China. Having said that, there is now spread to a number of provinces, so it's probably closing the barn door, etc. Interesting discussion. However, Ian McKay says maybe this will work because the virus is not spreading that we've seen anywhere outside Wuhan, and that there have been cases here and there outside of Wuhan, but not like a big spread of cases. So that could help. This person is a assistant professor, Jason Kindrachuk. I'm just looking at this discussion here I found. Assistant professor in Manitoba says, the limited human-to-human transmission makes this quarantine feasible in a small population, but 11 million, and instituting this without generating panic in that size of population. And Ian McKay says, nothing contemporary to compare this situation to. What is so weird? What about food? This person thinks the army might provide key infrastructural goods. Yeah, as Jason Kindrachuk says, how about work? We've talked about this. People won't be able to get to their jobs. Food, meds, work. How reliant is the population in Wuhan on day-to-day earnings? These are critical variables that need to be addressed adequately to not create panic or divisions. So again, starting in about, what time is it there? Is it 4.5 hours? Starting in about 4.5 hours, no more airport, train stations, or any public transportation in the city of Wuhan, and you're not allowed to leave. So lots of people won't be able to go to work because if you take public transportation, if you take a train. Super Ninja, thanks for your support, Super Ninja. Super Ninja, we passed along a report before. I had heard that the person in Brazil actually turned out to not have this. There was a suspected case in Brazil. But I had read a report before suggesting the person in Brazil did not have it. See if I can find it again. I'm not positive, but there was an account I saw before that suggested it was not a case. So I'll let you know if I hear any update on that. Thank you for your support, Super Ninja 252. If anybody finds me a more updated link on the Brazil case, possible case in Brazil, let me know. Tony, the airport site you sent me did not work. Link does not work. Daniel's Life says aircraft just took off from Heathrow heading to Wuhan. Hey, there might be people wanting, maybe there's people visiting UK who want to go back home and get to their home before they shut the place down. You know, if you live in Wuhan or you have family or a house there, you might want to be there and not get locked out of your city. Felix says these planes going to Wuhan should really consider landing in another city nearby if possible. Again, I don't know what the deal is with people who might have gotten on a plane to visit Wuhan and now are stuck on a plane there. I don't know how the airlines are going to handle that. Don't know. Oh, type speed. Oh, sorry. I don't know about that source. I've seen nothing saying that the Brazil suspected case was actually a real case. But current Wuhan time is 5:40 a.m. 5:40 a.m. Wuhan time. 4 hours and 20 minutes until the lockdown begins in Wuhan. Hey, thanks for the super hearts. Rob Van Roy, Dalton, Shara Goins, Tamara, Katie Murray, Misha, Default User Ghosty Girl, JoJo's Jacket, Dree, and Magic Moon. And thanks for moderating. Oh, all of our moderators, thank you. Mark Helton, Michael B., Amber Licious. In our YouTube chat, thank you. Also, our Periscope moderators, Linda Belk, Sharon Craig, MDMA, JKD, Fire Captain. Facebook moderators like Kimberly Peterson, Courtney Lane, Dan Lindquist, Essen Smith. And Twitch moderators, people like Matthew Johnson, Daily Disclosure, Keisha, Idaho Star, Umarath, Smoke, and others. But around getting close to 4 hours until this takes effect. Wow. And I you know, it's early morning there. It's 5:42 a.m. Tim says, look at Bing Maps traffic. All right. Now, I guess this is Wuhan. All right, Wuhan. Bing Maps, traffic. Traffic legend. You know, the thing is, I don't know what traffic is normally like there. You know, is it normally red at this time? I don't know. So this is a traffic map, Bing Maps, traffic in Wuhan. It's not a sea of red, but I don't know what it's normally like. Maybe people have just been told we've shut down the roads, so don't go on the roads. You can't get out. There's all these places you got to shut off, though, if you want to prevent people from leaving the city. And by the way, this is like many miles. This is like tens of miles. This is not like 2 miles. 2 miles is like this much. This is probably, 30, 40 miles across right here, if not more. There's some yellow, a bunch of yellow. Anyways, Bing Maps. Thanks for the suggestion. I'll have to write that down. No, I can't right now. Bing Maps. Anna says, haven't seen, heard one word about shutting down shipping traffic on the Yangtze River. It's the longest river in Asia, with Wuhan City sitting squarely on its banks. Yeah, I mean, they don't have to shut down, a ship going down the river. It's not like the ship is going to get covered with virus, as it goes down the river. The worry is that you don't want people leaving. So, they can fly planes in and out and drive trucks in and out. They just don't want people coming in and out. So I don't know why they shut down shipping traffic. They just wouldn't let, I assume what they wouldn't do is they wouldn't let people take boats there and take boats away. The passenger traffic. That'd be my assumption. Our viewer, Loretta, said there are other airports that service Wuhan. Now, the announcement I saw said airport. This one right here. Airport will be shut down. Airport, singular. But she says there's Hanan Municipal Airport. I don't know if that happens passenger planes. Oh, small aircraft. Yeah, that airport hint is small aircraft. So that you're not going to see passenger planes taking off from there. I don't know that there's I'm not aware of another major airport in Wuhan except for the one we mentioned. Hey, you're watching Agenda Free TV. We're bringing you live coverage of the virus situation with the China coronavirus. The number of people who have it is up to 560 total, 549 in China confirmed, 17 dead. But the huge news is that the city of Wuhan, 11 million people, is basically being quarantined. Starting in about 4 hours, you will not be allowed to leave. The airport will be shut down. The train stations will be shut down. No buses, no subways, no ferry, no public transportation. That starts in a little over 4 hours. Just a crazy situation. So guys, you know what I think I'm going to do? I think what I'm going to do right now is I'm going to take a break and eat some lunch and then come back on the air. So we'll come back on the air and actually cover this live, and I assume we'll cover it all the way till when the quarantine starts. So this might be a good time to take a little break. I'll eat lunch. I haven't eaten lunch yet. And then we'll come back on the air. I think I'm going to do that. So if you want to know when we come on the air, be sure to subscribe to the channel to know when we're coming on the air for our live breaking news coverage. That's what we cover. That's what we specialize in here: live breaking news coverage without an agenda. So subscribe to the channel. And if you're watching on YouTube and you're subscribing there, you're going to want to not just hit the subscribe button, but you need to also. You hit subscribe, and then you click on this bell, and you choose all notifications. See, there's a bell. So you got to hit subscribe, hit the bell, and then choose all notifications. Now, then you're getting the notifications. Otherwise, you're not. So I appreciate your help in covering this. A lot of people have been sending me news updates and news links. So thank you for your help in covering this. We're going to keep covering the story. And again, I'll take a break, and we'll come back, and we'll have a clock. We'll put a countdown clock up, and we'll cover the quarantine as it goes into effect. Thank you so much to our moderators. Really appreciate it. All the moderators: Amber Licious, Mark Helton, Michael B. Much appreciated moderators. And our Periscope moderators like Linda Belk, Sharon Craig, MDMA, Fire Captain, JKD. Facebook moderators like Courtney Lane, Kimberly Peterson, Essen Smith, Dan Lindquist, and others. Twitch moderators like Keisha Fowler, Umarath, Idaho Star, Matthew Johnson, Smoke, and I forgot somebody. Daily Disclosure, and others. Thank you to all of our moderators. Really appreciate all their help keeping the chats troll-free in the chat rooms. They're all volunteers. Amazing work by the moderators. If anybody wants to be a volunteer moderator, we can always use more moderators. The moderators can give you an email address that you can write to get more information about that. And also, you can follow me on Twitter at Lookner. At Lookner is where I'll post news updates when I'm not on the air. I post breaking news all the time at Lookner. Big thanks also to everybody who donated, because your donations are literally what keeps this channel going. So I really appreciate the support. Thanks for the donations. And if you want to support the channel with a donation, you can. Oh, thank you, Melissa Hafner, for the Facebook stars. Thank you, Melissa. I missed that before. Thank you, Melissa, for the Facebook stars. If you want to support with a donation, you can go to agendafree.tv, or you can go to the bottom of the YouTube chat and click on the $sign. Or in Facebook, you can donate using Facebook stars, where you buy some stars, you give them to a channel, the channel basically gets what you paid for the stars. You do that by clicking on the star button in the Facebook chat. And in Periscope, you can donate with super hearts by clicking on the star button there. And thank you so much to James Brain from the UK. Thank you so much, James Brain. Appreciate your support. Thank you, James. So I'm going to take a little break, have some lunch, and we'll come back and we'll keep covering this. Also, for those of you who are interested in talking to people from the chat rooms in between the broadcast, there's a Agenda Free TV unofficial fan Discord. It's like a message board chat room where people who watch the channel go between broadcasts and talk about whatever. If you sign up, it's free, but if you sign up, you actually get notifications when we're coming on the air. So that's the Discord, and you can get the mods can give you the address for the Discord if you want to check it out. Hey, thank you so much, James Mitchell, for your donation. Very much appreciated, James Mitchell. Thank you. All right. So again, we will keep talking about this story, and I'm just taking a break. I'm going to eat some lunch, and we'll come back on the air. Thank you, Joshua Harmon, for thanking the mods. Thank you, Amy List. Angie Eagle, Robin Cherry, Nicole Nelson, Deborah Lynn. And also thank you to Miss Misha and Ava Wire. Thank you, Beelzebub, J. Marie, TJ, Dr. Memes, New World is Here, Dom C., Craig Schwartz, Kevin Ford, I'd say I'll be on hopefully by 7, if not sooner. Like, let's say in like 2 hours from now, hopefully. I'm shooting for around 2 hours, give or take. Thank you, Smedley. Thank you, Christy Warshower. Thank you, Alibaba, SC, Donna B., L.A. Looks, Dawn Pratt, Lynn Smith, Amber, Thomas Hayes. Oh, it was Becky Scarlett I might have missed there. So, Becky, thank you if you were moderating. I just looked at the people I could see. Private Peppy, the Lorne G, WS, or the Lone G, I'm sorry. Small Wildflowers, Doobie the Cat, Bill Junking Fool, Brad Bauer, Relax at Sage Spa, David Dahl, Phoenix Rising, Jeff Farrow, Laura Chase, Team Harrison, Melissa McQueen, Elizabeth, Saka Macedonia, Tyler Heel, TJ, and everyone else for saying thank you. The Lucky Minute. Patrina Ray. And thank you, Shannon Toy. And Lori Strickler Mitchell. All right, guys. I am wrapping this up. I will be back shortly. I'm going to go eat some lunch, take a break, come back on, and we will cover more of this and we will cover the quarantine being put into effect. Oh, and thank you so much, Justin Herzog. Very much appreciated, Justin Herzog. Thank you for your support. Appreciate that. All right, guys, thank you. I'll be back on. Subscribe so you know when we're coming on the air. And we will see you soon with more live news coverage right here at Agenda Free TV.
No homma hieno, sehän olisi sitten pikkuhiljaa aika tulla meikäläisen kanssa saunomaan. Pitää vaan sopia seuraava jännäkoni tai joku muu miittinkin. Anderssonin kanssa. Mä en oo Breitbartia seurannut. Enkä tiedä minkälainen se on sisällöltä. Tuon mä tiesin, että sillä on yleensä aika hyvä asiasisältö. Mutta nyt ei hirveästi ollut tästä asiasta niin kuin sanomista. Ei tukea, kun laitetaan parempi tuommoinen hapen, mitenkä sanotaan, paremmin happea tarjoileva sauna. Ehkä mulla tässä alkaa olla. Okei. No, mulla ei nyt into riitä enää senaattia seuraamaan, että tässäkin oli jo tarpeeksi. Meni reilu 2 tuntia tämän WHO:n hätäkokouksen kanssa. Ehkä tällä taas vähän matkaa pärjätään eteenpäin. Palataan asiaan, kunhan seuraavan kerran jotain sanottavaa. Luultavasti tulevia täysistuntoja on katsellut, niin ensimmäinen suullinen kyselytunti on torstaina 6.2. kello 16. Periaatteessa tiistaina 14. olisi täysistunto ja puhemiehen ja varapuhemiehen vaalit, mutta en tiedä, onko siinä sitten täysistunto käytännössä mitään sisällöltään se täysistuntoa. Vähän mietin, laitanko noita vanhempia täysistuntoja, uusintoja niistä riimillä, mutta tosiaan en ole nyt kovin paljon tässä koneella, niin pitää katsoa ja näitä koneet muutenkin vähän semmosia, että pitäisi niille jotain keksiä.